MSF, we are here, I mean, since 20 years in Gaza. And you know that even before 7th of October, the health sector section were really suffering from due to the closure and siege. There was always 50% of items, medical items, which are zero stock. There was difficulties in referring patients to abroad for specialized treatment. So actually the health system was really fragile even before 7th of October. And what we witnessed during the last decades with the ongoing waves of violence that occurred at that time, I mean, always the health section was, or the hospitals or primary care were most of the time targeted. So, but this time, I mean, it was very difficult after the 7th of October and the retaliation of the Israeli army. I mean, there was clear targeting of the main hospitals in Gaza. I mean, it was not Kamal Adwan. Kamal Adwan was one of the last hospitals that has been targeted, but actually all the hospitals in Gaza were targeted. I mean, mainly Shifa, which is the biggest hospital in Palestine, not in Gaza as well, was targeted under evacuation, port evacuation. Same for Nasser Hospital in Khan Yunis, same for the Rafah hospitals. So what's happening in the Kamal Adwan was continuous of what was really since the beginning of this war. MSF was calling, doctors that what we were calling to avoid targeting health structures, hospitals, clinics, health staff. But unfortunately, I mean, this didn't actually had a kind of ear to listen on this, and we were addressing it to the Israeli side all time that we had faced this kind of targeting of health facilities. We were forced several times as well to evacuate. Our teams were forced to evacuate. Some of them were been arrested. And we as well addressed this to the Israeli side, but as well there was no information and there is no answer. What's going in now in the north, and Kamal Adwan, as you know, is the main hospital in the north area, the north of Gaza area, Jabalia, Beit Lahia, Beit Hanun. And it's the only hospital which provides medical care to the population who were remaining there. What happened recently, I mean, in the last 2 months, I mean, targeting the hospital directly, not, I mean, even around it, but directly to the hospital, arresting at the end Dr. Hussam and the team there. I mean, this is really something that we can call, I mean, it's part of the really ethnic cleansing. I mean, it's really the forced displacement of the population of the north, putting siege on them, blockade on them. I mean, the basic needs of life are not present in whole Gaza and mainly in the north of Gaza, Jabalia, Beit Lahia, Beit Hanun. We have teams who were working in the north at the beginning, but then they were obliged to leave as well because they are Palestinian team. I mean, they are from Palestine, so they have families and they were obliged as well to leave the north area. Now they are in Gaza City. The situation I cannot describe, but what they really saw, it's horrible. I mean, people are suffering from lack of basic needs. The water, the food is not entering to the north of Gaza. The health section now, there is no hospitals there at all. I mean, what is remaining is Indonesian hospital, which is partially, let's say, partially functioning, and there is no accessibility to it, to the hospital. Same as Al-Auda hospital, so you don't access it. It's just a structure there with a remaining team and patients inside, but no one can reach. So apparently there is no health provider now, no health structure, no hospitals, no clinics, no medical care in the north area of Gaza.